Good afternoon, our participants. Today, I would like to present our research entitled The Characteristics of Thai Dental Patients Visiting College of Dental Medicine, Rangsit University and Elderly Study. As we know, Thai become aging society. Therefore, the majority of dental patients are elderly group, and the most medical condition and medication use are related to the increasing age. So it is important to assess the condition of patients visiting dental treatment. The characteristics of dental patients have never been researched at Rangsit University College of Dental Medicine. Therefore, our objective is to study the occurrence of medical condition and medication use in group of elderly patients receiving treatment at the College of Dental Medicine during 2013 and during 2017, and to determine the association between medical condition, medication use, and patient demographic, as well as personal data in the study group. We record data from 755 dental child records from 2003 and 13 to 2017. The research project was being performed from December 2019 until March 2021. Inclusion criteria of this study was complete dental child record of dental examination of patient aged more than 12 years. By contrast, incomplete oral examination and dental child record and patient age less than 12 years was excluded from this study. For the result analysis, the data of dental patient child record was divided into two groups. First, group of adult group, referred as the patient child record with age lower than 60 years, and the patient child record with age more than 60 years were the elderly group. 88 dental child records of elderly dental patients were obtained and currently present. Patient information regarding age, sex, medication, medical history, drug use, and personal history was reviewed. Regarding to the result of demographic characteristics, we found that patient child record which age more than 60 years were 88 dental child record, which equal to 12.4%. In 88 elderly patients were 53 female and 60.23%, and 55 male or 39.77%. We can calculate the body mass index or BMI from height and weight data in the child record. The average of BMI in patients with age less than 60 years was 23.0, while in the elderly group, it showed the average of BMI was 24.626. Furthermore, we found the association of BMI according to age group. The average of BMI of elderly patients was significantly higher than adult group. According to blood pressure, the median of systolic blood pressure and the diastolic blood pressure in adult group were 123 and 72 respectively, while the median of systolic and diastolic blood pressure in elderly group were 139 and 74 mm mercury respectively, which were more than adult group both systemic and diastolic blood pressure. In addition, in the median systolic blood pressure of elderly was characterized in pre-hypertension state. According to the Joint National Committee on Preventive, Detective, Evaluation and Treatment of High Blood Pressure, JNC7 classification. Furthermore, our study showed a significant association between systolic blood pressure and the elderly age group. Regarding to the medical compromise condition, the occurrence of medication condition according to age group is shown in this figure. From totally 88 elderly patients, the medical condition were reviewed in 58% or 65.9%. According to the common medical condition, we will found that hypertension was the most common medical condition among elderly group, followed by diabetes mellitus and dyslipidemia. Furthermore, the statistically significant association between the elderly patient group and hypertension, dyslipidemia, diabetes mellitus, cardiovascular disease, genitourinary disease, and gastrointestinal disease was shown in our study. And the proportion of elderly patients with medical condition at 65.9%, with adult accounting for 27.3%, and teenager accounting for 17.1%. As shown in the graph, it's obviously found that the proportion of medical condition in elderly group is the highest, with the proportion of patients with and without medical problem in 1.9 to 1. With regarding to the medical use, the occurrence of drug use according to age group is shown in this figure. As a result, we found 55 patients or 62.5% report taking medication in the elderly group. Female took medication more frequently than male, which revealed 30 patients or 54.5% were female, while 25 patients or 45.5% were male. Accounted for the female to male ratio was 1.2 to 1. According to the common medication use, we found the cardiovascular disease medication were the most commonly prescribed medicine in elderly patients, which demonstrate 42.4%, followed by drug for diabetes mellitus and endocrine system, which revealed 16.3% and 12% respectively. Additionally, the statistics significant association between elderly patient group and drug for cardiovascular disease, drug for dyslipidemia, drug for endocrine, and drug for gastrointestinal tract was found in our study. According to the proportion of medication used among age group, it demonstrated that the history of taking medication and found mostly in elderly group, followed by adult and teenagers. And the proportion of elderly patients with and without medication use can accounted for a ratio of 1.7 to 1. We also studied in the medication history. The results show that the common duration of latest physical examination were in 12 months, which the elderly dental patient has more frequently of physical examination more than the patient which is less than 60 years. Regarding to the history of alcohol consumption, according to age group, it was shown that the elderly has a lower percentage of current alcohol consumption than the adult patient. Most patients in elderly group never has alcohol consumption or never smoke in the lifetime or were former, which means that the duration of quitting smoking and alcohol consumption was more than 1 year. Lastly, in conclusion, elderly dental patients have a higher incidence of medical condition and medication use, both of which are important in dental care. Hypertension, diabetes mellitus, and dyslipidemia are common medical conditions. That for cardiovascular disease, diabetes mellitus, and dyslipidemia linked to general medical conditions acquired are the most commonly used medication. Overweight, and high blood pressure are common in elderly for the dental care. In elderly dental patients, a true history it needs, as well as careful management to avoid dental complications and morbidity. Finally, we want to take this opportunity to thank you for Oral Diagnostic Clinic and Dental Chart Department of College of Dental Medicine, Rangsit University. Thank you.
Thank you so much, Mr. Warapak, for the nice presentation. So it's time for the question and answer. Is there any comment or any question? So while waiting for the question from the floor, you presented about the medication use in the elderly patient.
Yes.
Is the medication that you include in your study, is it just the prescribed medication or including the over-the-counter
Including over the counter. Yes, both of them.
Both of them. So is that okay? Okay, I can hear you. Okay. So if it's including the over-the-counter medicine, is this will change the perception of your study? Because some patients may use the medication without not knowing the real condition of their health.
Sometimes the patient cannot remember what they use medication. Sometimes the patient can't remember. We will not correct this data in the study. We use only the medication that the patient can remember or to the medication in the resetting.
I see. Oh, because this study is a retrospective study, right?
Yes.
You look at the data.
Correct from the data in the data chart record.
Okay, and one more thing. From your pie chart, this one item that quite interesting. When you compare the elderly and the people who under 60 years old, it shows that allergic disease tend to decrease in the elderly. But in most studies, allergic disease tend to increase in the elderly. Could you please discuss or have any comment on this topic? So the allergic disease that you collect in the study is just the food allergy or all kind of allergy from the data.
Because in this study we collect data from in variant age group. So the age lower than 60-year-old and more than 60-year-old was not equal. So we can compare the both group about the allergies.
Okay, I see. So that's quite interesting. So I suggest that you might research more in or review more in this topic to make a better discussion for your manuscript in the future. Okay, thank you so much. Is there any question from the floor? So we might finish early again. Thank you so much, Mr. Warapat. ขอบคุณค่ะ